The following program is being brought to you on the World Talk Radio Network. For more information about our network and to check out additional show hosts and topics of interest, please visit worldtalkradio.com. The World Talk Radio Network, where the world comes to talk. The views and ideas expressed on the following program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the World Talk Radio Network, its staff, and management.
Get ready to live a healthier life with minimum hassle and maximum results. Welcome to Dare to Be Healthy with nutritional therapist Alia Al-Muayed. Alia will use her experiences as a health advisor and mother to make health and nutrition a part of your life and the life of your family. Now here's your host, Alia Al-Muayed.
Hi and welcome to Dare to Be Healthy. This is your host, Alia Al-Muayed, broadcasting from the tiny little island of Bahrain in the Middle East. I'm a nutritional therapist, health writer, and health speaker, and I'm here to help you take your health to the next level. Today's episode is called Protect Your Child. Now, as soon as you become a parent, you start worrying about how you can protect this precious child. It's a big responsibility, or at least I felt that it was a big responsibility. How do you care for a child? What should you feed him? But also, how do you protect him or her from strangers, from bullies, from pedophiles? It's a topic that's not very pleasant to talk about, but so important to know. If you have children or know anyone who does, you can listen in on this conversation that I'm having with Dr. Rana Al-Sayrafi, a child safety expert and an angel in disguise. Dr. Rana, can you tell us a little bit about your background, how you started the Be Free Center that we're at the moment?
Be Free started in 2002, and we were just a group of friends. We were all worried about the protection of our children and the children that we see around us. And we were discussing how we can help. In 2001, when King Hamad came and a new charter came out, we were able to have our organization, which is Bahrain Women Association. And one of the programs was Be Free Center, which started in 2002.
And when you called it Be Free, what are you free of? What do you want them to be free of?
Very good question.
I'm always curious about the name.
It's this. Actually, when someone is abused, usually people and children or teens, they don't speak about child abuse. This is considered as a secret that one locks inside. And once we lock it inside, we become the prisoners of our secret, which is actually not a secret because everyone can be subject to abuse or has seen an abuse or heard about an abuse. But as long as we are keeping it as a secret, it becomes our own prison. And here we are asking either children or adults, victims of abuse in childhood, to speak about it and to get out of this prison.
But, I mean, you know, child abuse is a very big term and we use it regularly and we read about it. But when I was writing the questions even, it was difficult for me to think about a definition for child abuse. What forms of child abuse are there and what are we talking about really when we say child abuse?
Child abuse has different types, but all of them, they affect the way the child looks at himself and the concept that he builds around himself and his physical being, his emotional system. They are all connected. And if any harm gets to the child about the way his concept about himself, when it gets attacked, this is where abuse happens. Now, there are different kinds of abuse. Actually, there are 4 types of abuse. There's physical abuse, there's emotional abuse, there's sexual abuse, and there's neglect.
So neglect is also a form of abuse?
Yes, neglect is also a form of abuse. And it has its own types as well.
And what do you see most often in your center here? I mean, do people come to you, or do parents bring the child, or does the child call in, or how does it work?
We do it in different kinds. We accept any request to speak about abuse, and mainly we speak about how parents or caregivers or anyone related or works with a child can help in protecting children, either having training, seminar, or a talk. Or we also do workshops for children and for teens. We do it in Be Free Center, we do it in schools. We go into public places. We don't frighten children about abuse. We don't use even the word abuse when we speak with children. We give them essential protection skills that they can use to protect themselves. For example, how to have high self-esteem. That each person in this world is important. They are important. Each one of them is important. Having, for example, low marks in school does not mean that this child is not important. He is important. He has other skills, other traits that he needs to discover, other strengths that he can really build his success on. Also, we focus on bad secrets and good secrets, and how he can trust his feelings. If he feels that something is weird, something is going on, he needs to speak to someone he trusts. On the other hand, we speak with parents to have a strong and very close relationship with their children. Because actually in this world, which is very hard to control, the only safety measure that parents can give, or let's say the most important safety measure that parents can give to their children, is to stay close to them. That children feel safe to speak to their parents. When I say safe, I mean they feel it's okay. They can tell them things that they are afraid of telling someone else. And even to tell them that they did mistakes. Because many times children feel that it was their mistake. Even if sexual abuse happens to them, they feel this was their fault. And that's why they don't go and speak about it. Because at the end, they are to be blamed. And this is where the
pitfall.
Here, the abuser really uses this part to control the child. If you go and speak, then and you speak about it outside, then they will blame you. And this is our secret. Don't speak about it, and so on.
So to make sure that communication is completely open and free in the household, so that the child can come to you even with a problem that he thinks is bad, quote unquote, or that he did wrong.
Yes.
I mean, you hear stories about that all the time. But I'm curious to know also, what is your background that makes you want to do this? I know you have a PhD, and I'm just interested to know what it is that you specialized in that makes you want to do this. When I first got my degree, the bachelor degree is totally different. It's in IT and in accounting, minoring accounting, so it's a total different world. And then I continued progressing in project management. But my passion was more towards helping the community and protecting children. This was my passion. And it was my volunteer work that we do together as a group of friends. Until in 2006, this center was established with the support of Istirad Investment Company. And after having it, I decided that even my studies, I will change my path, and I will start studying counseling children and helping in protecting them from abuse, building their personality. And a very important thing to build and sow the seeds of values, human values in children.
which can really help them with themselves. They value themselves more, and even when they interact with others, they see the values as a base.
And I'm sorry, I just want to shut this. I'm also very curious about when you study something like that, or when you study counseling, and when you read about all these cases of the children being abused, doesn't it disturb you on a certain level? Because as a mother as well, you have children, and you read about, I'm sure you not only do you read about, I'm sure you see yourself cases in the center that have been abused or molested. Doesn't it disturb you or put you in a different mind frame?
Of course it affects a person, but we decided from the beginning that we as a group, we will work to help each other. And that is when one feels that we are getting affected by the cases, then we will take a break. The person, whoever is getting affected, needs to take a break. We'll speak to someone so that we heal ourselves as well, and make sure that our lives and our children do not get affected. Yeah. And we have certain trainings that we are going through regularly to make sure that we maintain a high standard of providing services to people, and at the same time protecting our own emotions.